Good afternoon. I'm Senator Matt Lesser, co-chair of the Human Services Committee, and I want to thank everybody for joining us. We're going to be holding an informational hearing very shortly with our colleagues on the Appropriations Committee to look at the new Medicaid rate study that we've gotten back from the Department of Social Services. Medicaid is our health insurance program for the poor in Connecticut, but it is also the primary way we pay for care for our neighbors and family members with disabilities, for our parents and grandparents in nursing homes, for home care, for group homes, community health centers, and hospitals. And of course, Medicaid and CHIP are where 40% of the kids in Connecticut go to get their health insurance. The reason for this study was very simple. We heard anecdotally everywhere when Representative Gilchrist and I were appointed to be co-chairs of the Human Services Committee, we heard from everyone that low reimbursement rates, and they have been frozen since 2007, have created real access issues. And I heard it here, but I also heard it in my district. In fact, my pediatrician, my kid's pediatrician who accepts Medicaid, was telling me when I went to see him about the challenges when there is a kid on Husky on the state's Medicaid program in terms of getting an allergist. He had to call in every favor in the book to try to get a kid in the door. And there is no reason, and there's certainly no legal justification that a kid on the 40% of kids on the state's Husky program should be denied the same health care that other kids get and should be denied basic access to health care. We knew that Medicaid rates were low in Connecticut. We knew they were 50%, 57% of what Medicare had paid in 2007. But until we got this report, I don't think we realized just how low they were. And what we found is that, yes, in some states, the rates are much higher. Medicaid in New Mexico, for instance, pays 120% of what Medicare pays. But this report specifically looked at Medicare pricing and looked at what our peer states, the closest states to us, states like New York and Massachusetts pay. What it shows, quite frankly, is that it's a miracle that we've been doing as well as we have when our rates are so out of whack. Go into a Stop and Shop in Connecticut and try to pay 57% of what something cost in 2007, and they will laugh at you. And yet we expect this to work for this vital part of our state's healthcare system. The report in particular highlights particular issues in behavioral health and with physician specialists that needs immediate correction. We did set a February 1st deadline for the study, and the hope there was that the results of the study would be incorporated into the governor's budget for this year. Unfortunately, that did not happen. We have $7 million in there, but that is not going to meet the need. Going forward, we need a plan from the governor on how to meet the many recommendations of this task force. We need to work collaboratively to figure out a way to make that work in the confines of the spending cap and the other fiscal constraints that apply on the state. And we need a rational way to set Medicaid rates. It should not be whoever gets the best lobbyist or who makes the loudest noise. We need a reasonable, rational way to make sure that we are funding this program appropriately, that we are addressing the access issues that are out there, that the people who rely on this, whether they are poor or people with disabilities or our kids, they have access to the program consistently. We're looking forward to that conversation. I think that really begins today, but we're going to really look to the governor for leadership to make sure that this is a priority that gets addressed this year before we adjourn, to make sure that we are doing making a dent into this issue. And I could go on for another 2 hours. I'm a member of the state Senate, but I do want to turn it over to my partner in all of this, my fabulous co-chair, Representative Jillian Gilchrist.
Thank you, Senator Lesser. So happy to see so many of you here because this is such a vitally important issue. Connecticut's Medicaid rates are discriminatory. With phase 1 of the rate study complete, there is no need to wait any longer to address the inequitable care and the workforce challenges that decades of underfunding has caused. As the good senator said, when we both became chairs of this committee, we heard from folks in our district, we heard from you. We had many meetings about the impacts of these low Medicaid rates. And here are just a few of the stories that stick with me. A dental cleaning in the state of Connecticut costs $120. Connecticut Medicaid just gives $20. I was told by a surgeon that the reimbursement for Medicaid doesn't even cover the knee replacement cost. And so he can only financially afford to do one knee replacement surgery for a Medicaid patient a year. Met with providers of autism services for children who were devastated that they can't be doing more for the Medicaid population of children, but they just can't financially afford to take those patients. And so there is a waiting list for Medicaid children in the state for autism services. And just last night at the Appropriations Committee public hearing, we heard from a radiologist that they make kind of an in-office joke that it would make more financial sense to just go out into the waiting room and give a Medicaid patient $500 and ask them to go elsewhere than to treat them because the rates are so low for radiologists. And so these discriminatory Medicaid rates cause two major issues in the state. They are creating inequitable access to healthcare for those with Medicaid in our state. And they're also contributing to the healthcare workforce crisis that we are experiencing in Connecticut. And so with over 1 million people in the state of Connecticut on Medicaid, we must take action. We can't wait any longer. And a recent tax incidence report illustrated that more than 800,000 people in the state of Connecticut make less than $22,000 a year. Well, the beginning rate for Medicaid, the eligibility rate, is around $23,000. So we're talking about a lot of people in the state of Connecticut who are on Medicaid. And these are children. These are children of substitute teachers. These are children of firefighters. These are children of social workers. These are our paraprofessionals. They are our personal care attendants. They are our neighbors. They are our friends. And so it is long overdue that we address these discriminatory practices, the discriminatory Medicaid rates, and looking forward to having this meeting to dive deeper into phase one, but really just committed to working with my colleagues in the House and Senate to push for change and to help both individuals on Medicaid and the workforce who wants to give them care. Thank you.
We have a huge number of allies in the House and the Senate, and we've been joined by some of them. And I just want to go down the list in no particular order. Representative Susan Johnson is with us, Representative Mike D'Amico, Representative Ann Hughes, Representative Kai Belton. And thank you for joining us this afternoon. There are a lot of things going on in the building, so we may be joined by other colleagues as well, but grateful for our allies in all of this. I'd now like to turn it over to Dr. Stacey Taylor from the Connecticut State Medical Society.
Thank you very much. Ladies and gentlemen, members of the press, and our very dedicated lawmakers, my name, as mentioned, is Stacey Taylor, and I am the current president of the Connecticut State Medical Society. Today, we confront a pressing issue at the core of our state's Medicaid system: the urgent need to increase Connecticut's Medicaid physician payment rates. Connecticut's Medicaid physician network struggles to meet the healthcare needs of its enrollees, evident in alarmingly long wait times for specialist visits, limited primary care options, hurdles in accessing obstetric care, and challenges in obtaining mental health services. These obstacles not only hinder timely access to care, but also jeopardize the health and well-being of our most vulnerable populations. Access to timely healthcare services is fundamental to preventative care and disease management. Early access to care not only keeps patients healthy, but also alleviates the burden on our healthcare system. It prevents diseases from progressing to critical stages, reducing costly emergency room visits and hospitalizations. To truly increase healthcare access for Connecticut's residents, we must enhance our physician network. Currently, many physician specialties have not seen an increase in Medicaid payment rates for well over a decade. As mentioned earlier, specialist payment rates barely reach 57% of the Medicare 2007 fee schedule, driving physicians away from Medicaid participation, exacerbating the shortage of healthcare providers available to Medicaid beneficiaries, and diminishing the quality of healthcare for Connecticut's Medicaid patients. Physicians, we are all dedicated to serving all patients, but they require adequate resources to do so effectively. Many practices operate as small businesses, and current Medicaid payment rates often fail to cover the cost of care delivery, leading to financial losses per patient seen. Moreover, as the Medicaid network shrinks, travel distances and times increase, further discouraging patients from seeking timely care and adding costs to the state. Increasing Medicaid reimbursement rates not only improves access to care, but also fosters an environment that attracts and retains top medical talent within our state, safeguarding the health of our communities. I have patients on Medicaid. Multiple times, I have seen the struggle they undertake to get the health care that they so deserve. As we address the inadequacies in Medicaid physician payment rates, let us remember that our actions today shape the future of healthcare across Connecticut. Thank you very much.
Next, we'll hear from Dr. Brianne Chandler.
Hi, everyone. Good afternoon. My name is Dr. Brianne Chandler, and I have been a dentist in Connecticut for 14 years. I own 2 dental practices in the state, one in Kensington and one in Colchester. I treat thousands of patients every year, including a small percentage of Medicaid Husky Health patients. And this is to serve the families in our local communities. I am also proud to have served in the Connecticut's Army National Guard as state dental officer for 8 years. And I volunteered at the South Park Inn Homeless Shelter Dental Outreach Team for the past 9 years, here in Hartford, just down the street. And I'm on the Board of Governors for the Connecticut State Dental Association. So while helping patients has been the focus of my life's work, the fact remains that I am running a small business. And like other small businesses, there are tremendous and increasing overhead costs, including dental supplies that now cost 4 times what they did pre-COVID, and insurance reimbursement rates that have been declining every year. The reality is that I cannot afford to be a Medicaid provider. And I say this as someone who knows firsthand of the many people in my community who need oral health care that I provide, because oral health care is essential health care. An untreated dental abscess can quickly lead to an emergency room visit, and the need to have one's neck or eye socket surgically cleaned out to stop the infections happens quickly. What was once a simple extraction becomes a life-threatening, expensive emergency surgery with needed follow-up. I do treat Husky patients now, but unfortunately, I have to turn some away. I want to continue to be a Medicaid Husky provider, but even if I donate my professional care like I do in the homeless shelter, a routine cleaning for a Medicaid enrolled patient costs me $63. I want to say that again. I lose $63 for every patient I treat for a cleaning, and much, much more if we do actual procedures, even basic ones. Okay. So this does not account for all the regulatory fees, insurance, rent, utilities, and other costs to running a practice that are included as well. So I simply cannot afford to lose that much money with every patient. No one can. It would financially ruin my practice and leave my existing patients without an oral health care home. Everyone in Connecticut deserves essential health care, including oral health care. But the current system is failing those who rely on Medicaid for their care. Waiting another year or longer to adjust the absurdly low rates in almost every type of dental care, cleanings, through complex restorations, and treatment of chronic diseases that negatively impact a patient's life is negligent. The effect of not addressing this systemic problem in the current session of the legislature will cause more people to delay essential health care, resulting in more chronic diseases. More catastrophic care, emergency care will be needed down the road, and be a further burden on emergency rooms to handle the relatively simple problems that, untreated, develop into potentially life-threatening or fatal situations. It will also contribute to dentists making the very difficult decision to discontinue being a Medicaid or Husky provider because they just can't afford to lose money with every patient. The dentists of Connecticut, in every town across our state, implore elected officials to represent the patients of Connecticut and allocate the necessary resources to provide care to those in need. Raise the rates so that the system is not upside down. The most vulnerable patients in our society are counting on you. Thank you.
And lastly, we're going to hear from Heather Gates, who's the president and CEO of CHR.
Good afternoon, everyone. As Senator Lesser said, I'm Heather Gates from CHR. We're a large behavioral health provider here in Connecticut. We provide mental health, substance use treatment services, supportive housing, foster care, and a range of other services. We serve over 25,000 children, families, and adults every year. We are also a CCBHC, which is a federal designation for a model of care funded by the federal government, but not yet adopted as a Medicaid benefit in the state of Connecticut. I'm delighted to be here today to talk about this urgent issue. For over 10 years, we've been highlighting in our testimony, in meetings with state government leadership, including OPM, and with the governor's office, the need to address the Medicaid rates for outpatient services for behavioral health. In all fairness, this cuts across multiple administrations. It is not just the current administration that has chosen not to act. Little has been done, and we now have a crisis in the behavioral health field based on the demand for service, the number of children and adults who need care who cannot access it. The rate study commissioned by DSS affirms what we have known to be true for many years, that the Medicaid rates for behavioral health services are outrageously low and produce gross inequities in access to care. The rates are 50% lower than comparison states. Fee schedules have not been updated in over 10 years. Methodologies and calculations have not been updated and are based on historical data that is grossly out of date, and there is no provision for updating rates. This comes directly out of the study. Our Medicaid authority has no system in place to provide a fair and equitable rate structure for behavioral health services for those most in need, as required by CMS. Outpatient services, which include things like therapy and medication management, including methadone clinics, are provided in individual, group, and intensive outpatient modes and are really the backbone of the community-based treatment system. It is the service accessed by the largest number of people. CHR alone serves over 10,000 children and adults in our outpatient clinics. It is also our single biggest financial challenge. And I do not enjoy standing up here and talking about our problems. I much prefer standing up here talking about what we're doing to solve problems, but this is a huge issue. As of the end of January, our clinics are losing $1.1 million. That's in a state that, for all practical purposes, does not allow us to profit from anything. So there's no way to make it up. This loss is related to the inability to hire clinical staff at salary levels that are now being demanded, which is 50% greater than they were 2 years ago. The vacancy rates contribute to turnover of existing staff who get burnout, quit, and go to private practice. They go work for the state of Connecticut. They go to school systems. They go to hospitals. They pretty much go to any other provider who get either reimbursed based on the cost of doing service or have the ability to pay higher. We have high caseloads due to the demand for services, and then the vacancies adds to this and to the pressure on our staff. Supervisors are covering, and this is not sustainable either. It's a vicious cycle and contributes to lower quality of care and is just very tough for our staff. As of today, we have 48 clinical openings. Now, we are a large provider. We have almost 1,000 staff, but 48 openings, 15 in our outpatient clinics, and the balance in our in-home services includes our crisis teams for both adults and children. This represents thousands of children and adults not receiving services. The outpatient vacancies alone mean 2,500 to 3,000 individuals are not getting the care they need. This increases the risk of suicide, overdose deaths, job loss, homelessness, and a sense of desperation and lack of hope in the future for so many. The study recommends increasing behavioral health rates in phase 1 up to the 5-state comparison rate. The estimated cost to bring rates up to the 5-state benchmark is $42 million, which quite frankly is a drop in the bucket in the state's budget, and with the current excess revenue that is being generated in the state of Connecticut. Phase 2 would involve adjusting rates using a rate model where rates are built from the ground up based on cost components and market factors. And then they need to be adjusted based on market conditions on a more frequent basis. That really means putting a system in place for figuring out rates that make sense. This is not rocket science. I thank you for being here today. And as you report on this study, and as any of you in this room who can influence policy, think about it. Please think about the people you know who may need help with the kind of services CHR provides as you make decisions and move forward with the work that you do. Thank you.
Any questions? Okay. Thank you very much.